Hello everyone, myself Krishna Trivedi, and today we are going to learn about the three topics, which is bone remodeling, effects of bone to aging, exercise and immobilization, and the third one is how can I prevent the fracture. So let us start with the bone remodeling. There are two types of bone, cortical bone and the cancellous bone. Cortical bone are mainly present in the skeletal, and the cancellous are mainly the spongy bone. We found it at the end of the bone. Bone is made up of two, which is cells and extracellular matrix. Cells again divided into the two types, which is osteoblast and osteoclast. Osteoblast is the bone building cell and osteoclast is the bone resorption cells. Extracellular matrix, there are two types of matrix, organic and the inorganic. In the organic matrix we can have collagens and proteins, and in the inorganic we have minerals like calcium and phosphorus. So what exactly happens in the bone remodeling? As you guys can see, there is a green part which shows the normal cells, and there is a red part of it, like one part of a cell is become old. So this is a old cell. What happen is osteoblast will come, it attracts towards that site and it act on that site, then it engulf, the osteoclast will engulf that old part and forms the cavity. During this, if the calcium is released, that calcium will comes into the blood, and it will help, that calcium will help in the other body functions. So it engulfs it, the old cells, then the osteoblast will comes into the picture. Osteoblast will come, they form the new bone, and you can say there is a healthy bone. Now the entire process is occurs in the five phases, which is activation, resorption, reversal, formation and acquisition. What happens in activation? In the activation, pre-osteoblast will come and they attract towards that site. What happens in the resorption? In the resorption, this things occurs, like the osteoclast will come and they engulf this entire thing. As you can see here, calcium can be released into the blood and it's used in the various body functions, and osteoclast disappears. So osteoclast will disappear in this phase. Then the, as I say, the osteoblast comes under the picture in the mesenchymal stem cells. Precursor to osteoblast appears along the burrow or a pit where now the osteoblast will come. Basically they are increased in the number and they convert it into the pre-osteoblast. And what happens at the last phase, the mature osteoblast will form a non-mineralized matrix, and then the, as we know that non-mineralized matrix are not as strong as the mineralized one, so the mineralization process also occurs at this phase. So now the matrix is mineralized with the calcium and phosphorus, and will end up having a major, or you can say a strong bone, until the next cycle occurs. So you can see it very well here, whether how the activation, resorption, reversal, formation and the resting phase occurs. The osteoclast will come, the osteoclast will form a cavity, then the osteoblast will come, it fills the cavity, then it forms a non-mineralized first, and then the matrix become mineralized and will having a strong bone, and again the activation occurs and the whole cycle occurs. So this is all about bone remodeling. Now, response of the bone to aging, exercise and immobilization. So first of all, the aging bone has reduced the mineralized content. We know that is calcium, the calcium deposition towards the calcium deposition in the bone reduces, and and ultimately patient will have osteoporosis. What is osteoporosis? Osteoporosis is a kind of a bone which is less dense and more fragile and very prone to the fracture. So bone resorption is occurs by the osteoclast, as I informed it earlier, so I'm not explaining it now. Osteoclast activities increase due to which reasons? So there are mainly three: inactive lifestyle, hormonal changes, loss of calcium and the other minerals in the bone. So as the older age people, they are not, you can see, very active person. So the inactivity is there. There are certain hormonal changes which occurs, for example, in the women's post menopause, when the progesterone estrogen level differs, and all these things occurs. Effects of changes in aging bone, osteoporosis in the older people and postmenopausal women, as I say. The major cause of hip fracture in the elderly, as we know that in hip fracture is a major fracture which occurs in the older people due to the osteoporosis. Decrease in the bone density of the vertebra combined with the loss of fluid in IVD. If the intervertebral disc lose that fluid property, so that we'll end up having a shortened vertebra and a curved trunk. So it's really bad. Reduced bone density and resulting poor posture, leading to pain, reduced mobility, and other musculoskeletal problems. Yes, risk of the injury increase because of a gait changes, instability, and loss of balance, and that leads to fall. What we can do to prevent it? Exercise is the most important for preserving the bone density. Which kind of exercise we can do is weight bearing, like walking, strengthening exercises using free weights or elastic bands, balance exercises. We know that static on static, static on dynamic, dynamic on static, dynamic on dynamic. So these balance exercises we can do. Healthy diet including vitamin D and the calcium, which is very necessary for the bone. Second, effects of bone to the exercises. Exercise works on the bone much like it works on the muscle. We all know that exercise is mainly for the muscles only. It helps the muscles to regain the to gain the strength and all. But it is as much as important for the muscles, for the bone. Sorry, important for the building a strong bone when we are younger, and it is important to maintain the bone strength when we are older. This is very important. Bone is a living tissue, changes over the time in response of force placed upon it. As we know that we are implanting force to any kind of muscle, that muscle will hypertrophied and gain the strength. The same goes with the bone. If we are applying weights to the bone will get started mineralized and it becomes strong. So when we exercise regularly, bone adapts by building more bones and become denser, as I explained. This improvement in the bone requires good nutrition, including adequate calcium and vitamin D. Another benefit, it improves the balance and the coordination in elderly. It helps to prevent the risk of falls that may lead to fracture. Yes, the other is exercise for the strong bone. What kind of exercise we can do for the strong bones, which is weight? There are two types: weight bearing exercise and strength exercise. Postural stretching and strengthening can also help in prevent or decrease the upper spine slumping in the older age. So the weight bearing exercises, first, activities which we do on our feet. These are called the weight bearing exercise. Muscles and bone works against the gravity. So if the muscle and bone has to work against the gravity, then it will gain the strength. When fell on the leg, when the feet and leg carries the body weight, it will make your bone work more harder. For examples, brisk walking, hiking, jogging, running, dancing, jumping, activities like tennis, badminton, group plays like basketball, group game like basketball, soccer, volleyball, stair climbing. Strength training exercises. During the strength training, resistance added to improve the muscle mass, right? To make muscle work more harder and become stronger, and also put a stress on bone and have a bone building capacity. So this is how the bone training will lead to the more denser and the stronger bone. Strength exercises with the weight machine, with the free weights, and exercise like push-ups when we are using our own body weight as a resistance. The other exercises such as yoga and tai chi may not as effective as a strengthening as effective at a strengthening bone, but it provides a significant flexibility and the balance benefits. Immobilization. Bone is a living tissue that responds to exercise by becoming stronger. But some people cannot perform the weight bearing activities. The patient which is a prolonged bed rest after a surgery or so, or a severe illness. Bone loss typically occurs over a several months and then gradually levels off as the bone adjusts to a state of weightlessness. What is the mechanism behind it? By immobilization, how the bone loss occurs. In the state of immobilization, bone becomes atrophied. The calcium which is present in the bone, it releases, and the calcium released by the bone and excrete in the urine and ultimately will having the bone loss and the hypercalcemia in the urine. This is a very danger thing. We have to take care about it. The last topic is how can I prevent the fracture. Falling is the main cause of fracture. There are several ways to prevent the falling, both in the indoors and the outdoors. So these are mainly, you can say, the advice kind of a thing that you can give it to your patients, mainly the elderly patients, you can say. So what are the indoors advices that you can give to the patients? The, the very basic things that keep your room free from the cluster, eliminates the wires and the cords which is comes across the walking area. Wear a shoes, not just a socks. We can say that socks are mainly, we find the socks slippery in some kind of surfaces. So I think rather than also shoes, ask them to wear sleepers at home with a good grip. Use a cane or a walker if you need to. Sometimes patient, use cane and walker only when they are out, not inside the house. So we have to convince them, and we have to make sure that they are using it properly in house, and obviously where they are out they are using, but in house also they are using it. Make sure your vision is as good as it is. Yes, it's very important. Sometimes patient, eyes become weak by age, so it's very important to do the regular eye checkup so that they cannot fall just due to the vision deficiencies. If your balance is poor, balance training and the physical therapy is important. What are the advices for the outdoors? Use a cane or a walker if you need to. The same, wear a rubber sealed shoes, shoes which has a good grip. This is very important. Pay attention to your surroundings and leave the porch light on. So these are all the advices that we can give to the patient to prevent the fracture and to prevent the risk of fall, I can say. So this is all about the three topics. Thank you for listening. Thank you so much.